Hello everyone, I am Raviteja and today we are going to see the topic of Disorders of Growth Part 2. This video is presented by MEDeaze and MBBS freaks. The objectives of today's video are tall stature, failure to thrive, macrocephaly and microcephaly. Tall stature. Tall stature is defined as height greater than 2 standard deviation for age and sex. The causes of tall stature are familial tall stature, constitutional acceleration in growth, obesity, syndromes like Marfan syndrome, Klinefelter syndrome, Sotos syndrome, homocystinuria, and endocrine causes like hyperthyroidism, growth hormone excess, sex steroid deficiency or resistance. The management, if it is familial or constitutional, reassurance and explanation is sufficient. If it is causing significant psychological impact in pubertal children, we will do early induction of puberty. In pubertal children, we'll give high dose sex steroids. These both methods are used to hasten epiphyseal fusion. Failure to thrive. It is a term used in children below 5 years whose physical growth is significantly less than peers of same age and sex. The diagnostic criteria is weight for age, weight for length, BMI less than 5th percentile, weight for age, weight for length below 75% of median, weight for age and weight for length crossing two major centiles, and there is failure to gain weight over time. These are the diagnostic criteria for failure to thrive. The clinical features are poor growth and development, poor cognitive functions. Etiology. The causes of failure to thrive are organic and non-organic. The organic causes are in GIT, gastroesophageal reflux disease, inflammatory bowel disease, pyloric stenosis. The neurological causes are mental retardation, cerebral palsy. The renal causes are renal tubular acidosis, chronic kidney disease. The cardiopulmonary diseases are congenital heart diseases, cystic fibrosis, asthma. The endocrine causes are hypothyroidism, diabetes mellitus. The infections are HIV, TB. The genetic causes are chromosomal abnormalities and inborn errors of metabolism. The non-organic causes are poverty, lack of breastfeeding, lack of knowledge of feeding and nutrition. The diagnosis. Failure to thrive is a clinical diagnosis. First, you have to take history, physical examination, and observe parent and child interaction. If any organic cause is suspected, we have to proceed to lab investigations. Those are CBC with ESR, urine and stool microscopy and exam microscopic examination and culture, renal function test and liver function tests, serum electrolytes. Management. The management includes nutritional rehabilitation, parental counseling, and education. The medical management includes treatment of underlying disease, psychological management includes behavioral modification, and if there is any history of abuse and neglect, then hospitalization and admitting into foster homes. Then developmental management. This is the management of failure to thrive. Microcephaly. Microcephaly is defined as occipitofrontal circumference less than -3 standard deviation below mean for age and sex. This is known as microcephaly. There are two types of microcephaly. First is primary and second is secondary. Primary microcephaly occurs due to decreased generation of neurons during neural development. Secondary microcephaly is caused due to injury or insult to previously normal brain. This causes decrease in dendrites and synapses. The causes of microcephaly are syndromes like trisomy 21, 18, 13, structural diseases like neural tube defects, metabolic disorders like phenylketonuria, infections like cytomegalovirus, herpes simplex virus, HIV, syphilis, teratogens like alcohol, tobacco, marijuana, cocaine, perinatal insult like hypoglycemia, endocrine disorders like hypothyroidism, hypopituitarism. You can remember the causes with the mnemonic MISPET: metabolic disorders, infections, structural diseases, syndromes, perinatal insult, endocrine, and teratogens. The management, we have to evaluate for microcephaly if occipitofrontal circumference is 2 to 3 standard deviation below the mean. You have to take history and physical examination. We have to do developmental assessment, and we have to check head size of parents. If it is severe or there is a history of antenatal insult, we have to do neuroimaging, that is MRI, CT, etc. Macrocephaly. Macrocephaly is defined as occipitofrontal circumference greater than 2 standard deviation for age and sex. It is known as macrocephaly. The causes of macrocephaly are megalencephaly is increase in volume of the brain. It is caused due to familial neurofibromatosis, Soto syndrome, Fragile X syndrome, then increased cerebrospinal fluid like hydrocephalus, enlarged vascular compartment like subdural, epidural, subarachnoid hemorrhages, increased in bony component like achondroplasia, osteogenesis imperfecta, osteopetrosis. The miscellaneous causes are cysts, abscess, or tumors. Management. In macrocephaly, if there is increased in CSF, it is hydrocephalus. If there is increased in brain volume, It is megalencephaly. Megalencephaly is divided into metabolic, syndromic, and familial. In metabolic, the diseases are Tay-Sachs, Canavan. The syndromes are Sotos, neurofibromatosis type 1, Noonan syndrome. First, we have to evaluate if occipitofrontal circumference is greater than the standard deviation for age and sex. In familial, we have to measure head sizes of parents. If it is asymptomatic, no treatment is required. In hydrocephalus, neurosurgical intervention is needed. For all causes, neuroimaging is done. That includes CT, ultrasonography, MRI brain. Thank you.